Good morning, everyone. I'm glad to be here, and I'll be talking about trends and opportunities in the health sector. This morning, apart from being a trained doctor, medical doctor, my sole passion is in the development of health sector in Africa. I run a company that strengthens health systems back to back, from service delivery to human resources for health, to health financing, and all the rest of them. There had been a very big, big, big stride in technology all over the world. If you look at the health sector in Africa, you realize that it seems we have a lot of catch up to do. I remembered when those days when we were growing up, we have to go to to make a phone call. You need to get some coin, and you go to the booth to put some coin and make some calls. Then after some time, then you can make landline calls. The telecom sector kept getting better over the years, over centuries. If you go to other sectors like banking, manufacturing, oil and gas, you see a lot of technological advancements all across sectors. But it seems there is a problem with the health sector when it comes to technological advancements. The developed countries, they've done a lot in healthcare, most especially in the areas of technology development, and they are reaping the fruit. Mobile Health News says 4 million patients will globally remotely monitor their health conditions by 2020. There are questions that I would like ask the healthcare leaders. Questions like, how are they leveraging technology to stay innovative against their competitors? How do they leverage technologies to stay innovative against competitors? What measures are healthcare leaders taking to implement advances in technology in the sector where they find themselves? What are the strategic partnership and joint ventures that they are pursuing, to be able to find opportunities for growth? How about collaboration? How has the healthcare sector really collaborated with other sectors? The issue with intersectoral collaboration is still a very big challenge in healthcare in Africa. So you begin to see that as times are changing, healthcare in Africa, they're also changing. But the rate of change is what we cannot really measure. The goal of Internet of Everything or Internet of Health Things is to provide an enabling environment to make health decisions and outcomes through digital insights, also to achieve situational awareness and intelligence. We realize that in our climb, what obtains here actually is different because of our culture, tradition, and the way that we do things. This slow growth of development can be linked to poor infrastructure all across Africa. Health organizations around the world, they are looking for how to reduce cost, and they are also looking for how to improve patient experience as they are improving healthcare populations. But this is the challenge. We are not thinking of reducing cost in Africa. In as much as we pretend to be thinking about reducing cost, healthcare costs in Africa, the burden of diseases goes up, healthcare cost is also going up. The concept of universal health coverage that is all over the place is still trying to find its place in this part of the world. Why? Because of our value system. Gone are those days when a patient comes to the hospital and all what the physician is concerned about is, I treat you, you go. It has now come to the age of patient-centeredness. It has come to the age of outcome of health. Oh, this person came to the hospital, she had myomectomy, she was discharged, and she had no complications. She's gone home, so healthcare has been delivered. That's not what is now obtained all over the world. All over the world all over the world, everybody is trying to measure the patient experience. What does the moment of encounter looks like? What experience did this patient have going through the health system and coming out of it? Is it an experience that is holistic, or is an experience that is just the provider-centered? So across all sectors, digital transformation is recognized as a powerful enabler of patient-centered care, smarter decisions, and better outcomes. I visited an hospital last weekend where in Abuja here, where a colleague had a baby. So I was like, oh, congratulations and everything. So there are 3 women in that ward. So I was like, so how did it go? How did it go and everything? She was priming. It was her first time. And she said, oh, I had a CS. I said, what happened? Why did you have, what happened? What was the indication for the cesarean section? So she said, she's a doctor, so she's supposed to know what indications for emergency of that kind of an emergency obstetric care is, if it's an emergency cesarean section. But as was not emergency, she went to the hospital on her own. So she began to speak about high cost of healthcare delivery in that government hospital. She said, almost everybody that comes here gets caught. Even though if there are no indications for cesarean section, somebody just wants to cut somebody up so that your bills can go up. She also said something like, whether you have a CS or you don't have a CS, even though if it's a normal delivery, everybody during antenatal has to pay 10,000 naira for blood transfusion, whether you ever get the blood or you never get the blood. So I was wondering, in this generation where everybody is trying to minimize how much money healthcare gobs, having an understanding that public spending on health is highly reduced and is very inefficient. So she said, if you ask everybody in this place, everyone will tell you that this particular hospital, they just love to keep people on the bed. That the normal practice of 24 hours after spontaneous vaginal delivery and you are good and your baby is good and you be discharged home does not apply in this hospital. After you give birth, you will wait another 72 hours, 3 days before you are discharged. So she began to recount how much money, people spend in that particular facility. And she was recounting it as a very painful experience. So in Africa, we need to buckle up and find a way of reducing healthcare cost. What are some of the challenges in healthcare in Africa? Challenges with insufficient infrastructure. Over the centuries, you see that healthcare infrastructures are dilapidating and new ones are not being built. Then, over the years, there had been a lot of money, both from public offices both from the public sector and also the private sector, into the healthcare. And it seems as if it's not translating to anything. So you look at the super specialty hospitals around the country, and you were like, okay, when there was no oil and gas, University of Ibadan Teaching Hospital was established, Luth was established, and many other places around the country, Namdi University, and the one in Zaria. So now that we've had a lot of money, what's distribution of tertiary hospitals across the country really? Infrastructure in healthcare is a big challenge, and it has constituted so much nuisance in this sector. Inadequate skilled workforce. Everybody knows that you can't get a doctor in some places. Some of my colleagues recently had an accident along Kaduna Road. 6 of them died. They're doctors from Ekiti. And one of them that was fortunate to be alive was recounting, and he said, when we got to the hospital, it's a general hospital by the roadside, we met a lot of nurses, but there were no doctors. And it was like somebody was crying and said, please, can I get blood? Please, if I don't get blood, I'm going to die. And the guy bled and bled until he died. So it was a very painful experience, because that kind of situation happens every day. We only heard about this one because it happens to people that are healthcare practitioners. What are we going to do in Africa to step up our game, to make sure that healthcare delivery is improved? The problem of procurement and distribution systems, problem of access to fundamental health prerequisites. We cannot link environmental data to health. We have a very big problem with dwindling donor funds in Nigeria. We've so much depended on donor fund over the years, and we've neglected our responsibilities in Africa to foreign partners to keep bringing the money, and we keep spending it. I read in a newspaper recently, last week, there was a heading, who stole the HIV money? It's unfortunate that so many people that are living with HIV and AIDS in Nigeria won't have access to commodities, to drugs, to antiretrovirals. But some people were saddled with the responsibility of policy, of distribution, but they failed at it. They were eating the money. God will not forgive them. We also lack capacity for implementation. Over the years, we've depended so much on donors to implement many of our healthcare projects in Africa. And the little capacity that we have built over the years, I agree that we've built some capacity over the years, but we need to build more capacity to be able to implement our healthcare projects. In addressing healthcare challenges in Africa, we need to pay attention to our healthcare delivery system. Our healthcare delivery system in Africa is very weak, and I believe that technology has the biggest role to play in revamping the healthcare delivery in Africa. We need to begin to adopt what I call appropriate technology, because the technology that is available in some part of this world that is the best fit for their climate is different from our own climate. So we should learn how to shift some tasks to lay healthcare workers in the primary healthcare centers. There are community health officers, community health extension workers, the CHUs and the JCHUs, scattered all over, working in all over, the primary healthcare centers in Nigeria. Many of them had some traditional trainings in basic management of childhood illnesses and diseases and basic obstetrics care. Even at the primary health care level, they can give immunizations and stuff like that. But a doctor will not go and work in that primary health care center because of known disadvantages of staying in the rural community and stuff like that. So we know that technology has a big role to play, in our healthcare system. If we can step up the level of knowledge of people that are working, that cadre of workforce at the primary healthcare center through e-learning programs, and so on and so forth. We need to expand access to secondary care because of our weak cluster system in the Nigerian healthcare system, Africa generally. We need to expand access to secondary care. So someone comes from Kuje and he comes to a hospital in Metama. Actually, there's supposed to be a cluster system within Kuje access that that referral is supposed to go to. But because we have a very weak and a very, very bad referral system, so we will just refer people to anywhere that comes to mind. So I also believe that technology can help us to be able to expand access to secondary care so that somebody will not come to University of Abuja Teaching Hospital to come and treat malaria, while all the secondary care facilities in Nigeria have almost shut down. Go to several general hospitals all across the nation. You will see that it's just few of them that are measuring up to their responsibility. We need to rely more on technology. We need to resolve our procurement log jams. I was consulting for Shopee a few years ago, and I was in one local government in Kaduna State. So I was trying to audit a PSC in that local government, and I found that I was trying to audit their their supply chain and procurement management system. How do they get their drugs? The story I heard was really very touching because of lack of coordination in the health sector, because of weakness of procurement and supply chain with drugs and consumables. Many facilities suffer. Many facilities are not even working because the drugs that were supposed to come there from the so-called central medical stores will not come there. Those drugs will stay in those stores until they are expired. And those drugs cannot be accessed by people that were supposed to access those drugs. Why? Because of problem with procurement and supply chain. I believe that technology has come a long way to be able to help us to manage that kind of problem. We need to implement universal health coverage. We need to make telemedicine ubiquitous. I'm going to expatiate on that later. We need to encourage local suppliers. We need to find sustainable financing. Community healthcare insurance in Africa is the way forward. We need to find a sustainable health financing model and mechanism that works for our climate. We need to refocus on primary care and preventive care. I asked someone that called and said, my mom couldn't move her legs and her hands for 3 days now, and she's been home. And where they live, there are no standard hospitals. How does that kind of a woman and 1 million other women and men all across Africa, how would they have access to a neurologist? How would they have access to a cardiologist if not for technology? How would they have access? We need to refocus on preventive care. Majority of our efforts have been on curative. Of course, and we know that in the 21st century, according to research, by 2030, communicable diseases is going to match up with communicable diseases as major causes of death in Africa. Today we are celebrating HIV, celebrating malaria, and all those other things, where diabetics, hypertension, hypertensive heart diseases, and all other chronic diseases will actually overtake that over the years because we're not paying attention to preventive care in Africa. And this is why I also think that technology has a big role to play in preventive care. If you go to or if you go on Facebook, you see that there had been a lot of, on social media generally, you see that there had been a lot of ways where the Internet of Healthcare things has really has been helping people that couldn't have access to doctors or couldn't have access to healthcare workers at different levels. So I stumbled on a group that someone added me, Ask the Pediatrician. So it's a group where they talk about everything that has to do with child health. Then ask the gynecologist. So different people come on those sites. They come to ask questions. They give the site admin give a lot of lectures, and people will just be celebrating those information. So the question is, can I just go online on my own to just say, okay, I want to learn more about this particular sickness or disease or whatever, and just go to Google and just find out by myself? Yes. But that kind of interaction between a provider at the other end and also the client at this other end makes the healthcare ecosystem to go better, instead of people just going to. So people ask their physicians questions online and they're able to respond to them. While we have a lot of challenges so great, we also have opportunities for healthcare reform in Africa. One of the opportunities is we need to shift our focus and think system strengthening. We need to think system strengthening. When a doctor graduates from the medical school, he didn't take a course in entrepreneurship. He didn't take a course in accounting. He didn't take a course in management. He didn't take a course in operations management or whatever. He finishes the medical school. He does housemanship. All the exposures that he has had all through his life are clinical exposures. So he goes to youth service, and from there he becomes a medical officer. He becomes a registrar. From there he becomes a consultant. He gets hired. All his life, 20 years, is spent in the clinic. All his years is spent in the clinic treating patients. No formal education in management. No formal education in management. So the same way the doctor will manage a patient is the same way he wants to manage a system. So he rises up and he becomes the CMD, the Chief Medical Director of a hospital, of a government hospital. That is why what we see today is a replica of the decisions that we have made in Africa. This is my terrain. Nobody comes there. But in other climes, we know technology has helped people to be able to develop a lot of skills in the areas of management and hospital management. And we also know that there are healthcare managers all over the world that are not necessarily doctors, and they are managing health systems perfectly well in other places in this world. I'm not saying that a doctor cannot be a good manager of a hospital, but if we now begin, if we are in Nigeria, for example, we've already conditioned our mind that it's only a doctor that can be a chief medical director of anywhere. In fact, I remember a few years ago when a former president wanted to appoint a minister of health, and that minister of health happens not to be a doctor. There was a very big problem. Why will he appoint a minister of health that is not a doctor? Then the man said, Your Excellency, if you are looking for a minister that will do policy, health economics, health financing, health planning, and put the country together, then I'm available. But if you are looking for a health minister that is going to be a minister to be treating patients, then I'm not the one. And he got that appointment. And his tenure stood out in the healthcare sector in Nigeria. What am I saying? I'm saying that we need to leave this mindset and allow other people that are also capable to manage our systems for us. We need to reduce our reliance on international aid organizations. It's obvious that there are a lot of problems all over the world and everybody is looking for money. There has been a lot of global meltdown and that has really affected funding. So right now, what obtains is we are increasing domestic funding for health all over the country. A lot of international organizations say, can governments be responsible? Can African governments be responsible to take care of their own? It's so bad when they are even supposed to commit to counterpart funding, you will realize that they are not even committing. They are not committing. Why? Because the donor agency does everything. Managing director of Apollo, one of the managing director of Apollo Hospital said, I think that the next big thing to revolutionize the healthcare industry is technology. There has to be a consistent acknowledgement of what technology can do in terms of healthcare delivery. We have to invest in it and find ways and means to be extremely cost-effective in taking the point of care from within the hospital system to the doorstep of the consumers. Now, some of the new frontiers in health technology is what I call the digital health policy and strategy for implementation. Because our lawmakers, our policymakers in Africa, they need to come up with policies for digital health in Africa, because there have been a lot of challenges, even where Internet of health things have really grown and developed. There have been a lot of issues that has to do with regulations and control, and of course in the sector. So it is good for us to have a digital health policy and also the strategy for implementation. We also need to do technology. We also need technology integrated solutions. By that I mean e-care. So normally somebody will just call my phone. Hello, Dr. Jimlas, please, I have a cough and I'm also doing this, I'm also doing that. Please, what can you advise that I use? So I care for the person electronically. The person doesn't have to go to the hospital. I ask a few leading questions that to rule out one or two things. So if it's what we'll be requesting, a laboratory investigation, or say, go get this test, just scan it to me, just take a picture of it and send to me, let me see, then I can prescribe, okay, go and take that drug. That person doesn't have to contribute with the high level of waiting in the hospital system. The waiting time is one of the biggest challenges that technology has come to solve in the healthcare delivery system in Africa. Waiting times. You have an emergency surgery, you have an elective surgery, and you have to wait like about 3 to 6 months before it can be your turn. So people are brought in on emergency because the fibroid is now bleeding. Because when she came to the hospital in the first place, the fibroid has not started bleeding by then. But because there were a lot of people on the queue, so they cannot just say, oh, we do this now, because it's actually not an emergency. So at the end of the day, people wait and wait and wait until it's their turn. And another thing is that people come to the hospital. A pregnant woman comes to the hospital for 8 o'clock in the morning just for an antenatal, and she never goes back home until 3 p.m. And out of those long hours, the contact time, the moment of encounter with a healthcare worker is not up to 20 minutes. Spend 5 minutes at the, of course, a lot of minutes are spent with the medical record. You want to look for your folder and stuff like that. You spend maybe like 5 or 10 minutes with the doctor. Then you go to the pharmacist to also go and collect drugs and all the times you have with all the health workers is now maybe like about 30 minutes, and you spend over 5 to 6 man-hour time in the hospital. These are big problems that I know that technology, Internet of Health, can help us solve in Africa. Telehealth, drone technology. I saw a paper presentation from one of the African countries, how they use the drone technology to deliver blood to remote areas when there is need for blood transfusion. Because many of those remote areas don't have storage facilities either for immunization and for blood. So there is because of technology, they communicate using a mobile health technology. Oh, we have an emergency. We need blood. And when the signal gets in here, they use a drone technology to send blood from this central place to that particular health center because of the GIS mapping. I think these are one of the things that we can improve on in Africa climb. There are also a lot of development, like robotic technology has also come up, where robots now do ward rounds. They go in the morning to take vitals, and it helps the physician to be able to focus on more health priority. Now, how is the Internet of Things actually revolutionizing healthcare in Africa? We have a lot of things that has been done. Please, can you play that video?
But Uganda still struggles to end the conflict. Kampala, Uganda's capital city, is attracting young social entrepreneurs eager to use technology to improve the quality of life for its people.
William Golding writes in The Lord of Flies that the greatest ideas are the simplest.
Meet Joshua Okello. Before even graduating from college, he designed an ultrasound app for smartphones with his partner, Aaron Tashabe. They had grown frustrated with the high infant and maternal mortality rates in childbirth and pregnancy.
And the number of reasons that lead to this, they all revolve around cost, around distance, around equipment. So it's something that really spoke to us.
Most clinics can't afford an ultrasound, so a baby's heartbeat is monitored by a 100-year-old device called the Pinard horn.
We modified this, and then on top of that, we have an app.
The app diagnoses, alerts, and suggests courses of action.
Even a less experienced medical personnel can provide close to the same standard of care that a person in a more affluent area gets.
We decided to put it to the test. We found a maternity clinic in Kampala and met up with a midwife named Joy.
How many babies have you delivered in your career so far?
About 200.
Ruth is pregnant with her first child. She came to the clinic after falling down at home and was worried she might have lost her baby with the fall. First, Joy demonstrates the old method of checking a baby's heartbeat.
You have to listen and count with the clock.
And then the new one.
You just connect here and put here, then you begin measuring.
That's the heartbeat.
That's the heartbeat of the baby. This one is better because she is also sure that her baby is alive.
Joshua isn't the only one using technology to provide people with better access to healthcare.
There's a time when we're going to not have malaria in Africa, and that time is coming soon.
Meet Josh and Brian, students at Makerere University. They created a mobile app for malaria diagnosis. Accurate diagnosis is the most important step in eradicating the disease because it prevents people from seeking wrong treatment. Traditional testing requires using needles to draw blood, but the Matubabu app uses a light sensor to detect malaria from red blood cells. Even though the app is still in development, the hope is that this fast and accessible tool could have a major impact. Malaria targets expecting mothers and young kids. The disease kills more children under 5 than HIV/AIDS in sub-Saharan Africa. We learned that Joy is also treating Ruth for malaria. Ruth agreed to help us demonstrate how the app works.
So all she does is to plug in her finger inside here, and then I say start here. It takes around 60 seconds.
This is a good device for someone who doesn't necessarily have access to a hospital or a clinic.
Sure. So it's finished.
Okay.
So what you're going to do is you're going to check the results and message them.
Okay, so that's just telling us what people are doing in technology to be able to improve healthcare. Those young guys that came up with that app that can detect malaria, that can also check fetal heartbeat even at the rural communities. I'll round up by saying that there are a few applications that people have done, people have made a few applications like the Future Path Medical Eurosense. That is a smart fluid solution that automatically measures urine output where in chronically ill patients that are on catheter, and it can provide data directly to the nursing station, to be able to, for patient monitoring. Then, of course, the Philips Medication Dispensing Service has helped a lot of elderly people all over the world to be able to be drug compliant, and many other stuffs like that they have done. How are the Internet of Things revolutionizing healthcare? We have a lot of wearable sensors that has been done that, when there is any problem anywhere, the sensor just triggers at the other side of the facility, and they come for help. Of course, this has also helped us to be able to gather a lot of data. There have been a lot of fitness tracking devices and health monitoring gadgets all over the place. There are medical devices, gadgets like ECG monitoring, necklaces, and also mobile diabetes testers. There are also digestible sensors that monitors body systems. Telemedicine helps in remote diagnostics and treatment. We will get to that place where we will have to leverage on technology, on the internet, to be able to attend to patients. Right now in America, a lot of companies are having big turnovers because people don't want to come to the hospital. So people sit at the back end, just plug in to pay some money, and a doctor says he earns $40 per consultation when he does this. So people at the other side, this is my complaint, this is that, even though you can order for a few tests here and there, and the person comes back with the result, and you can treat right there. So people, it's happening all over the place, and it's one of the things that I think we can look at in Africa. Self-care through virtual health communities, massive influx of healthcare data as a result of IoT, and which has generated data from electronic health record system and healthcare information exchange. Thank you very, very much.
Thank you, Doc.